Many people have a problem with grinding their teeth, and what happens is your temporal mandibular joint, or TMJ, becomes very hard. Sometimes the muscle hypertrophies or grows, and what we found is when we inject Botox or a neuromodulator into the area, we can actually soften that muscle, make it less large or less hypertrophied, and that actually treats the TMJ. The treatment usually lasts for about 3 to 4 months, sometimes even longer, and it also will take away a lot of the fullness in this area and give your face a more oval appearance.